Hi friends and viewers, once again you are welcome to Angel Health Academy. Subject Community Health Nursing. Topic for the day is Community Health Nursing Process. Community Health Nursing Process. Definition of Community Health Nursing Process. Community Health Nursing Process is a problem-solving process that addresses community health problems at every aggregate level, with the goals of preventing illness and promoting community or public health. So, community health nursing process is a problem-solving process. It solves the problems of a particular community with the goals of preventing the illness and promoting the optimum health of the community or public. Next is steps of community health nursing process or phases of community health nursing process. There are mainly 4 steps or phases. First one is assessment phase, second one is planning phase, third one is action phase, and fourth one is evaluation phase. Assessment phase, planning phase, action phase, and evaluation phase. Let us discuss assessment phase. Assessment phase includes community identification. It is the first phase of community assessment. Community identification, otherwise known as first level of assessment or initial assessment. Community identification usually done by conducting health survey. Definition of community identification. Community identification is a systematic process of knowing and exploring the defined community for assessing its health status and determining the possible factors affecting the health of the people or health problems of the people in that community. A systematic process of knowing and exploring the defined community for assessing its health status and determining the possible factors affecting the health or health problems of people in the community. The elements of community identification. There are 4 elements or components of community identifications, which includes planning of data collection, data analysis, and community profile and community diagnosis. Let us discuss one by one. First element is planning of data collection. Planning of data collection means understanding the community and establishing a good working relationship with that community. Planning of data collection includes understanding the community. That means understanding the geography of the community, location of the community, boundaries, population of the community, social organization available in the community, and the culture, customs, traditions, beliefs, healthy practices and unhealthy practices of the people in the community, and establishing a good working relationship with the community. Planning of data collection includes categorization of information required, approaches or methods of data collection, and sources of information. Let us discuss one by one. First one is categorization of informations. Categorization of informations required are geographical characteristics, population characteristics, and social system or social political system of the community. Geographical characteristics includes geographical area of the community, geographical location or boundaries of the community, physical setup of the community, the natural resources available in that community, flora and fauna of the community, that is poisonous plants and disease-carrying animals present in the community, forests, jungles and animals if present, important landmarks of the community and institutions available in the community, and environmental sanitation. Categorization of information regarding population characteristics, that is size of the population, density of the population, composition of the people, vital events, vulnerable or high-risk groups in the community, social structure of the community, social stratification, social control system available in the community, community organizations and group dynamics available, leadership pattern, lifestyle of the people, communication system availability for the public. Information required regarding social system. Social system is an orderly and systematic arrangement of the social interactions. So, social system is nothing but an orderly and systematic arrangement of social interactions, also known as socio-political system. Socio-cultural, socio-political and administrative subsystems includes housing, food pattern, education status, health status, environment, protection, recreation facilities, communication facilities, transportation availability, welfare of the people, law and order, economic, political and legal system of the community, etc. Planning of data collection includes various approaches or methods of data collection. So methods of data collection includes listening session or community forum or community meeting. observation method, interview technique, physical examination review method, discussion or conversation method, questioning technique, case study, and other methods such as clinical examination, investigations, etc. Sources of information regarding geographical characteristics or aspects, population characteristics or population, social system or socio-political or social subsystems, and others. Sources of information regarding geographical aspects could be available from the maps or area maps of the community, local administrative bodies, development departments such as block development office, from agricultural department, legislative department, and other development committees, etc. Source of information regarding population could be available from census, registered departments of birth and death, Department of Health and Department of Intelligence, annual report of the community, epidemiological surveillance report or record, and notification record, local health departments, and from health service record and reports in the health centers such as sub-center, primary health center, community health center, etc. Sources of information regarding social system or social subsystem would be available from local political and administrative bodies of the community, local development departments of the community, and key informants from various system and subsystem of the community. Sources of information also available from other sources such as community environment, community people, formal and informal leaders of the community, health personnel available in the community, and other officials available in the community, etc. So, the second element of community identification is data collection. Data collection is a systematic approach to gather information from a variety of sources we have just discussed to get a complete and accurate picture of an area of interest. Area of interest here, it is related to the particular community. So, data collection is a systematic approach to gather information from a variety of sources to get a complete and accurate picture of an area of interest. Steps in data collections. There are 8 steps in data collections. First step is define the community to be studied or to be collected data. Set tentative community goals. Third step is determine the specific information required or categorization of information required. The fourth step is identify the population and the sampling unit from the community. Then fifth step is choose the sample size and sampling method. Sixth step is decide methods and instruments for data collections. Seventh one is develop the instruments and tools based on the methods and instruments already decided. Then eighth step is organize and conduct the health survey to collect the data or information. So the steps in data collection include define the community to be studied, set tentative community goals, determine specific information, identify the population and sampling unit, choose the sample size and sampling method, decide methods and instruments for data collection, develop the instruments or tools, and organize and conduct the health survey in the community. The third element of community identification is data analysis. Data analysis is a process of extracting, compiling, and modeling the raw data for the purpose of obtaining constructive information that can be applied to formulating conclusion, predicting the outcome, and supporting the decision which has been done. So data analysis is a process of extracting, compiling, and modeling the raw data for the purpose of obtaining constructive information about the community that can be applied to formulating the conclusion and predicting the outcome or supporting the decision. Phases of data analysis. There are 4 phases in data analysis: data categorization, data summarization, draw the inference from the data, and reporting the findings or result. Then compiling and analysis of data. Compiling and analysis of data. Compiling and analysis of data includes coding, key punching, organizing and arranging the data for tallying and compiling, presenting the data from the tally sheet into the tables and graphs for descriptive analysis, then statistical analysis, interpretation of the data, and reporting the findings. The fourth element of community identification is community profile and community diagnosis. So community profile is a diagnosis of health needs or health problems from the interpretation of the collected data after analysis. So the diagnosis of health needs and health problems from interpretation of collected data. Community profile includes community diagnosis. The definition of community diagnosis. Community diagnosis is the vital and strategic point from which a community health nurse has to proceed as a team leader to solve the community health problem or problems and to provide healthful or healthy living condition to the community. So community diagnosis is the vital and strategic point from which a community health nurse has to proceed as a team leader to solve a community health problem or problems and to provide healthful living condition to the community. Community diagnosis always like an iceberg phenomenon. The iceberg phenomenon describes a situation in which a large percentage of a problem is subclinical or unreported or otherwise hidden from the view during community diagnosis. Only the tip of the iceberg could be seen or apparent to the epidemiologist during the survey or during community diagnosis. So iceberg phenomenon means when an ice cube put into the glass or jar of water, the major part of the ice cube will dip in the water and a small portion will be above the level of the water. So when we do the community diagnosis, it's like iceberg phenomenon. 90% of the problems or cases could be invisible, only 10% hardly visible during the community diagnosis. So majority of the percentage, that is 90%, could not be visible during community diagnosis. This phenomenon is called iceberg phenomenon. The second phases of community health nursing process is planning phase. Planning phase is purely based on community diagnosis or community profile. The purpose of planning phase is to determine the course of actions to meet the health needs of the community and to resolve the health problems of the community. Community health planning. Community health planning is a systematic process which involves logical decision making at each step of its process. So community health nursing planning is a systematic process which involves logical decision making at each step of its process. The process includes mainly 4 steps. The first step is analysis of diagnosed health problems. Second step is establishing priorities. Third step, setting goals and objectives. Fourth one is formulation of community action plans. So there are 4 steps of community health planning, that is analysis of diagnosed health problems, establishing priorities, setting goals and objectives, and formulation of community action plans. Let us discuss one by one. First is analysis of diagnosed health problems. Analysis of diagnosed health problems usually done to clarify the nature and extent of the problems. To clarify the nature and extent of the identified problems. And analysis of diagnosed health problems, also known as second level assessment. Sometimes we require further collection of some specific information to clarify the nature and extent of the problems. The second step is establishing priorities. Establishing priorities refers to ranking of the health problems. It is necessary because of the limited available resources, man, money, material. Criteria for ranking health problems includes 6 criteria. First criteria is type of health problems. Second one is extent of the problems. Third one is severity of the consequence of the problems. Fourth one is salience feature. Fifth one is preventive potential. And sixth one is modifiability of the problem. So first criteria for ranking problems are types of health problems. According to Ruth Freeman, there are 3 types of problems. Health deficits, health threats, and foreseeable crisis points. Let us discuss what is health deficits, what is health threats, and what is foreseeable crisis points. Health deficits means illness state or failure to thrive, disability state or amputation, etc. Health threats includes family history of hereditary diseases, faulty eating habits, unhealthy lifestyle practices, and threat to cross-infection, etc. all comes under health threats. The foreseeable crisis points includes the different stage of the life, marriage, pregnancy, parenthood, divorce, loss of job, death, etc. The second criteria for ranking problem is the extent of the prevalence of the problem. May be high prevalent or it may be low prevalence, depends upon. Depending upon the number of people affected and timing of the prevalence and seriousness of the problem. And all are affected, all in the community are affected with this problem. So these are the second criteria, that is extent of the problems. The third criteria for ranking problems is severity of the consequence of the problem. How serious this problem, how significant in the community, the nature and magnitude of the resultant problems of this problem associated with the mortality, morbidity, disability, injury, accidents, violence, crime, all those associated with this problem. That is the severity of the consequence of the problem. The fourth criteria for ranking problems and the problems is salience. Salience feature refers to the community's perception and community's evaluation of the problems in terms of seriousness and urgency of attention needed. So it is the community perceptions or community evaluation about the selected problem and its urgency of attention needed. The fifth criteria for ranking problem is preventive potential of the problem. Whether the problem is preventable or not preventable. It depends whether the problem is preventable or not preventable. The sixth criteria for ranking problem is modifiability of the problem. Whether the problem can be resolved. Possibility of resolving the problems. It depends upon the availability of the resources. 3 points rating scales can be prepared to evaluate each problem to find the modifiability of the problem. Third step of community health planning is setting goals and objectives. The goals are an aim or an intent. It describes the desired changes. Goals describe the desired changes and it refers to the purely refers to the community diagnosis. Then goals and objectives. Not only it gives a direction or determine the relevant action, but also it helps in sustaining and evaluating the actions planned and implemented. The characteristics of a good objectives always follow SMART. SMART means S stands for specific, that is it set the target. M stands for measurable. The result has to be measurable. A stands for achievable within the available resources. R stands to be the relevant. And T stands to be the time bound, achieved within the specific time period. So the characteristics of the good objective always follow the SMART. Specific, measurable, achievable, relevant and time bound. The fourth steps of community health planning is formulation of community action plans. Formulation of community action plans is another important step of nursing process. Formulation of community action plans means the identification of appropriate or effective community health and nursing interventions or strategies and preparing an operational plan to be implemented to achieve the established goals and objectives. There are 6 criteria for the formulation of community action plan. Agency policy, the resources available, the nature of the problem, the community's interest and feasibility of the problem, competency of the health personnel, and practicability and efficiency. There are 8 steps for developing community action plan. First step is opening step. That includes introduction and socialization. Second step is social environmental mapping and financing. Third step is identifying the problems, needs and resources potentials. Fourth step is determining the priority in the need. Fifth one is formulating the choice of strategy. Sixth one is formulating the implementation plan. Seventh one is formulating the monitoring and evaluation plan. And eighth one is implementing, monitoring and evaluations. Let us discuss in detail. First step is opening. So the steps of community action plan has to be communicated with the community people through an opening session with the introduction and socialization. Second part is social environmental mapping and financing. So social environmental mapping and financing means once again develop a community map with the latest information that would give a better picture of the problems and priorities. The third step is identifying the problems, needs and resources potentials from the community. So identifying the actual problems and available financial resources. Then fourth step is determining the priority in the need. Ranking according to the urgency and their importance. Then fifth step of developing community action plan is formulating the choice of strategy. Developing the most feasible strategy and approaches. Developing the most feasible strategy and approaches. Then sixth step is formulating the implementation plan. So formulation of the schedule and division of tasks for the health personnel. Formulation of schedule to do the implementation and making division of tasks for the health personnel available. Seventh step is formulating the monitoring and evaluation plan. So make a format of evaluation for the monitoring and evaluation of the community health plans after implementation. Then implementing, monitoring and evaluation. So carry out the actions and at the same time monitor the actions and evaluate the actions. An important aspect of planning with the community is participatory approach. Let us discuss what is participatory approach. So planning with the community. What is being planned for the community is planned with them. So we need a participation from the community. So it will aid the self-esteem, it create interest among the community people, and it will develop a sense of responsibility and autonomy among the community people. The purpose of planning with the community is to sensitize and motivate the people to feel the seriousness of the health problems and realize the importance of finding solution. The steps in participatory approach includes meet the community, present the problems in order to the priority, be flexible to change the priority according to the community perceptions, and use participatory problem solving approach and discuss the actions at the end of participatory problem solving approach. So first step is meet the community. After the community identification, if possible the whole village or the whole village people or the selected village leaders, village health committees and planning groups has to be met in a common place and share the findings and present the problems in order to the priority to the group or during the meeting. And the third step is be flexible to change the priority according to the perception of the community people. Then, usually the participatory problem solving approach is done with the 3 stones approach in the remote areas. It includes large stone, medium stone and small stones. So, it includes large stone, medium stone and small stones. So, this is the picture of participatory approach. What we do in participatory approach, we call for a community gathering in a convenient place, arranging 3 type of stones, so 3 sizes of stones, as I said, large, medium and small stones, selecting the representatives from all the age groups for the meeting, and drawing the symbol of the health problems on the floor with the chalk. Asking the representatives to keep their stones according to the priority or needs or according to their perceptions of the seriousness or urgency of the problem. Then finally calculating the significance of the health problems. So we can give that score for large stones 10, medium stones 7 and small stones 5. Then as the community people, representatives keep the stones according to their perception to different problems, health problems which has been drawn as a symbol, we can calculate and we can the significance of their perceptions. Then calculating the significance and finalizing the problem to be solved immediately according to the community perception. Then only we'll get the community participation. This is called a participatory approach. Fifth step is discuss the actions to the community people. So discuss the actions that can be planned and finalized in the same meeting if feasible, or we can call a separate meeting later and it can be discussed with the community people according to the finance and according to the available resources. So the third phase of community health nursing process is action phase or implementation of community health nursing process. The term implementation refers to putting the health plans into actions to achieve the set objectives and goals of community health. The purpose of implementation is to help the people learn to help themselves in solving their own health problems. The second purpose is to help in meeting their own health needs. The third purpose is to help in using their own resources, so as to attain and maintain optimum level of health. The steps of implementation. There are mainly 5 steps in implementation. The first step is review of overall plan and understand. The second step is mobilization of the resources. Third step is establishing good working relationship. The fourth step is implementation and fifth step is documentation. Let us go in detail, review of overall plan and understand the strategy and schedule. What, when, how and who. Then second step is mobilization of the available resources for the implementation of the community action plan. Then establishing working relationship, a good working relationship with the community and getting their active participation. Then implementation. Implementation can be done as it is or it can be modified if necessary. Then final step is documentation. Recording all the interventions implemented. Recording all the interventions implemented, progress made, any difficulties or constraints encountered during the implementation. So these are the steps of implementation. The last phase of community health nursing process is evaluation phase. So this is the final step of nursing process. It involves determining whether the goals have been met, have been partially met or have not been met. In the evaluation we are determining whether the goals already set have been met or have been partially met or have not been met. So evaluation actually it has to be done at each step of nursing process starting from assessment to evaluation. The definition of evaluation is a systematic process of determining the extent to which the objectives are achieved. The systematic process of determining the extent to which the objectives are achieved. Evaluation has got two parts. So it is a two-part process. First part is identification of the objectives or goals towards which the nursing process is aimed. The second part is the judgment of whether these goals are being achieved or not. The types or forms of evaluation. There are mainly four forms or types of evaluation: formative or concurrent evaluation, summative or terminal evaluation, quantitative and qualitative evaluation. Formative or concurrent evaluation includes structure evaluation and process evaluation. Summative or terminal evaluation includes outcome evaluation. Let us discuss what is formative and summative evaluation. So concurrent or formative evaluation is it includes the structure evaluation and the process evaluation. Structure evaluation means evaluation of the resources, infrastructure and resource and money material. The process evaluation includes the evaluation of the activities, skilled nursing practices. Then next is terminal evaluation. That is done at the end of the implementation, at the end of the healthcare activities, at the end of the determined period with set goals and objectives. This is also known as outcome evaluation. So to know the result of the implementation, we use outcome evaluation. Evaluation also has got 5 steps. First one is determine what is to be evaluated. Second one is establishment of standards and criteria. Third one is planning the methodology of evaluation. Fourth one is gathering information by using this methodology. Then finally analysis of the result from gathered information. So steps of evaluation includes determine what is to be evaluated, establishment of standards and criteria, planning the methodology, gathering information, and finally analysis of the results. The tools of evaluation. Evaluation could be done by using certain tools. So direct observation. Evaluation can be done by direct observation. Evaluation could be done by questioning technique, and evaluation could be done with the record review method. So we record soon after the implementation of healthcare activities. So later it could be reviewed. The record can be reviewed. So today we have been discussed about the community health nursing process. Community health nursing process is a problem solving process that addresses community health problems at every aggregate level with the goals of preventing illness and promoting community or public health. There are 4 phases in nursing process or steps in nursing process. They are assessment phase, planning phase, action phase and evaluation phase. So thanks for watching. I hope this video really benefit in your studies. If you feel this is worth, please subscribe, share and like. Stay tuned with Angel Health Academy till we meet with another important educational video. Thank you.